This is Preventative Healthcare for Women by Marissa. Contraception. This is a strategy or device to reduce the risk of fertilization or implantation to prevent pregnancy. A nurse should identify whether the patient desires or needs or has a certain preference for contraception. There should be a thorough discussion of the benefits, all the risks, the alternatives of each method. And this is natural family planning, which is abstinence, which means not having sexual intercourse, which is the most effective method of birth control, which obviously also prevents STDs because you are not having sexual intercourse. Then we have withdrawal of the penis from the vagina prior to ejaculation. This is the least effective because the pre-ejaculatory fluid can leak from the penis prior to ejaculation, which can contain sperm, and you can get pregnant from that. Most people don't know when they are going to have the pre-ejaculation, and this does not prevent STDs. We also have the calendar rhythm method, which is tracking your period, and it's determining your fertile days because you tracked your period, and it should estimate the time of ovulation, which is not very reliable, and it does not prevent STDs. Next, we have barrier methods, which the penile condom. It's a thin sheath used to cover the penis during sex. You check the expiration date, check for latex allergies. They do make condoms that are latex free. This does protect you against STDs. There's no adverse effects. You also have the vaginal condom, which is a vaginal sheath that inserts into the vagina. After each act of intercourse, you throw that away. The same for the male condom as well. You do throw that away after each act of sexual intercourse. It is more expensive. It is considered bulky, sometimes noisy, and it can be expensive. Hormonal methods such as the combined oral contraception, which is a medication that requires a prescription and a follow-up with a provider. Medication also requires consistent and proper use to be effective. It is highly effective if it is taken correctly, consistently, and at the same time daily. We also have the emergency oral contraception, which is considered the morning after pill. This is also known as a Plan B. Take it within 72 hours. Do not take it on a regular basis. There is weight limits. It should be on the back of the box. It does not terminate a pregnancy. It does cause heavier than normal menstrual bleeding in most people. Transdermal contraceptive patch, which contains estrogen and progesterone. It delivers at continuous levels throughout the skin. It requires patch replacement. Apply the patch the same day of the week for 3 weeks and no application the 4th week. We also have the contraceptive vaginal ring, which is a flexible silicone ring, and you insert it vaginally. It does not reduce the risk of STDs. It is reported to be uncomfortable during intercourse. We have the implantable progestin, which is also known as the Nexplanon. It's a little rod that goes under your skin in your upper arm. It is said to be effective for 3 years. It can cause an irregular and unpredictable period. We also have the IUD, which is a chemically active T-shaped device placed in the uterus by the provider. You must monitor your device monthly. After your period, you ensure that the presence of the small string is still hanging in the upper part of your vagina. Surgical methods such as the tubal ligation. This is a surgical procedure consisting of burning, cutting, tying the fallopian tube to prevent fertilization. This is permanent. It is an immediate contraception. It does not protect you from STDs. Diagnostic and therapeutic procedures such as screening tests and lab tests. Screening tests, we have the breast exam. Clinical breast exams are not recommended for average risk clients, such as they don't have a personal or family history of breast cancer, no BRCA gene, no cancer such as any cancer, and they also have not gone through chest radiation. Most unexpected findings are detected when the client is performing their regular routine ADLs. You should inform your patients to become familiar with how their breasts look and feel. So that way, if there is any abnormal findings, that they do realize that it's abnormal and they report it to their provider. Next, we have the pelvic and bimanual exam, which is at a clinic in a lithotomy position with good lighting. The provider inspects the external genitalia for any abnormal looking things such as trauma, lesions, masses. The internal pelvic exam is inserting a warm lubricated speculum into the client's vagina to examine the cervix. A bimanual exam is an internal exam, 2 fingers into the vagina and the opposite hand on top of the abdomen. You should get this done 6 to 10 days after your last menstrual cycle, but it doesn't have to be, and you should void prior to the exam. The digital rectal exam, the provider can examine the client's rectum, pelvis, and lower abdomen. The provider inserts a gloved and lubricated finger in the client's anus and can palpate the rectum and anus. We have some more screening tests. We have a mammography, and the breasts are compressed vertically and horizontally by the mammography machine. You should avoid deodorant, lotion, and powders prior to the exam, just because they can get false readings. Self-examine your breasts regularly, and it may be slight or temporary discomfort during the mammogram. Um, Then we have the abdominal, pelvic, and breast ultrasound, which is non-invasive. It uses sound waves. Some people do say it is mildly discomfort, but not often do people say that. You identify unexpected findings, detect abscesses, and evaluate trauma. We have some more screening. For laboratory tests, we have a STI panel, which includes blood culture, urine. You can identify syphilis, HIV, HSV, gonorrhea, chlamydia, HPV, trichomonias, hepatitis B, and hepatitis C. These can be done through many different ways, such as orally, urine, blood, drainage. You also have the pap smear. During the pelvic exam, a provider obtains the fluids or cells by using a little brush or a spatula, and then they send the specimen off to the lab. Pap smears can detect lesions, cancers, dysplasia, HPV. Pap smears are recommended from the age of 25 to 65, and that would be an HPV test with the pap smear every 5 years. If you reach 65 and your pap smears have came back normal, then you do not have to get them as regularly once you hit 65. But if they were abnormal, you will have to continue to get them. Okay, and this is just a reminder, do not skip your annual gynecologist appointments. Your health is important. The longer you wait, the worse it could be.